Hispanic members of Congress pressed some of the nation's top disease experts on how to improve access to COVID-19 resources.
KXAN's Wes Rappaport explains they noted dramatic disparities in COVID-19 data in Latino communities.
Hispanic, male, Hispanic, female, Hispanic, female, Hispanic.
Baylor College of Medicine Dr. Peter Hotez read off the people who died of COVID-19 on an August day in Houston, an all-minority list.
I'm calling this historic decimation of Hispanic Latinx communities across the southern part of the United States.
That's something we have to shout from the rooftops.
Demographic data from death certificates filed with the state indicates more than half of coronavirus-related deaths are Hispanic, shown here in powder blue, and a breakdown of close to 54,000 completed case investigations reveals Hispanics make up 40% in Texas.
I just had a very difficult time trying to acquire a testing kit, especially since I didn't have any health care.
Juan Sanchez is sure he had COVID-19 earlier this year, but wasn't sure how to get the resources he needed, so he quarantined for 2 weeks to keep him and his loved ones safe, sacrificing pay because he's an independent contractor for a grocery delivery company.
These communities need the help and resources to go get tested or to get more information about how to prevent it.
One of the nation's top doctors, Anthony Fauci, agrees.
They have a higher incidence of the comorbidities which put you at risk. That's something that you do not fix in a month or a year. It's something that requires a decades-long commitment.
Wes Rappaport, KXAN News.
Dr. Fauci told the Congressional Hispanic Caucus there are 5 vaccine candidates in phase 3 of the trial in the U.S. He expects we'll know more sometime at the end of the year or the beginning of next year whether or not those are safe and effective. And he hopes vaccines will be available for widespread distribution by April.